Welcome back, everybody, for another deep dive.
Always fun to dive in.
Yeah, and today we're looking at, well, you sent over some really fascinating excerpts
Yeah.
from the 2025 American Diabetes Association's Standards of Care. Specifically, DC 25003.pdf, focusing on diabetes prevention.
Right.
And it is a dense document, but we're going to break it down
Absolutely.
so that by the end of this, you'll have a solid grasp
Yeah.
of the latest recommendations and hopefully some food for thought
Yeah.
about your own health or someone you care about.
Absolutely. And it's a great place to start, prevention,
Yeah,
because that's really where we can make the biggest impact.
for sure, for sure. So let's kind of unpack this.
All right.
The document jumps right into prediabetes.
Right.
And I know it's kind of like, a precursor to type 2, but
Right.
what makes it such a critical point?
Well, it's all about early intervention.
Okay.
You can think of prediabetes as a flashing warning light, right?
Okay.
So it means your blood sugar is elevated, but not high enough for a full-blown type 2 diagnosis.
Gotcha.
But the ADA is really stressing annual monitoring for anyone at this stage.
Yeah.
Because really, the earlier you catch it, the better your chances of preventing or at least delaying the progression to type 2.
Makes sense. But I mean, isn't there always a
Yeah.
chance that tests can be a little bit off or...
You are absolutely right.
Yeah.
And that's why personalized care is so important.
Yeah.
So, for example, there are conditions like hemoglobinopathies,
Okay.
which affect the structure and function of your red blood cells.
Yeah.
These can actually skew the results of an A1C test,
Interesting.
which is often used to diagnose prediabetes.
Okay.
So if you have any underlying health conditions,
Right.
it's really crucial to discuss those with your doctor
Yeah.
to ensure accurate testing and really those personalized recommendations.
So no one-size-fits-all approach.
Absolutely not.
Gotcha. So assuming you are diagnosed with prediabetes, what can you actually do
Right.
to turn things around?
So this is where the Diabetes Prevention Program, or DPP, comes in.
Okay.
This is a landmark study that really showed the power of lifestyle changes.
Okay.
Specifically, they found that losing 7% of your initial body weight
Okay.
and getting at least 150 minutes of moderate intensity activity per week.
Okay.
So think brisk walking or cycling
Okay.
can reduce the risk of developing type 2 diabetes by a whopping 58%.
Wow, 58%. That's pretty incredible.
It is.
But let's be honest, losing weight can be really challenging
They're
for
true.
a lot of people.
Very true.
So,
But here's the thing.
yeah.
Even if someone doesn't hit that weight loss target,
Okay.
just meeting that physical activity goal alone
Right.
can still significantly reduce their risk.
Okay.
So the DPP found that those who met the physical activity goal,
Yeah.
even without significant weight loss, still saw their risk drop by 44%.
Wow. So getting moving is a huge win,
Huge.
regardless of what the scale says.
Absolutely.
That's encouraging. So consistent exercise, it sounds like, is non-negotiable.
It's pretty key.
What about diet? Any specific recommendations there?
Well, the ADA is actually moving away from recommending a single best diet.
Interesting.
The research really shows that a variety of eating patterns
Yeah.
can be effective for diabetes prevention as long as they emphasize
Okay.
whole unprocessed foods.
So we're talking...
Yeah, like Mediterranean,
Okay.
low carb, vegetarian,
Okay.
plant-based, even the DAH diet.
Okay.
The common thread is prioritizing nutrient-rich foods,
Gotcha.
things like whole grains,
Yeah.
legumes, nuts,
Okay.
fruits and vegetables, over processed fare.
So it's more about the quality of your
So,
food choices than
yeah.
sticking to like a rigid diet plan.
It's about making those sustainable changes,
Yeah,
right, that actually nourish your body and help regulate blood sugar levels.
that makes sense. Okay, so we've got exercise and diet down.
Oh, right.
Now this next one might surprise you because it's not something we typically associate with diabetes. Sleep.
Right. It might seem a little unexpected,
Yeah.
but research is revealing this fascinating link
Okay.
between sleep and diabetes risk.
Interesting.
And it's not just about how much sleep you get,
Okay.
but also the quality of your sleep
Right.
and even your chronotype,
Granite tape.
meaning whether you're naturally a night owl or an early bird.
Oh, wow.
There's this U-shaped relationship with sleep duration.
Okay.
So both too little and too much sleep can increase your risk.
Wow, that is surprising.
Yeah,
Most people, I think, just focus on getting enough hours.
right. And while that's important,
Yeah.
it's clearly not the whole story.
Yeah.
So the sweet spot for most people seems to be around 7 hours of quality sleep.
Okay.
But it can vary.
Yeah.
based on individual factors. But the research suggests that consistently getting poor sleep or significantly deviating from your natural sleep-wake cycle can disrupt hormonal balance, increase inflammation, both of which can contribute to insulin resistance.
Gotcha.
And raise your diabetes risk.
So prioritizing sleep is right up there with diet and exercise.
It's all connected.
It's all connected. What happens, though, when lifestyle changes alone aren't enough?
Right.
Do medications ever come into play for pre-diabetes?
That's where metformin often enters the picture.
Metformin. I thought that was only for people who already had type 2.
It is used to treat type 2.
Right.
But research has shown it can also be effective for preventing it.
Okay.
Particularly for those at higher risk.
Okay. So?
People with a BMI over 35.
Okay.
A history of gestational diabetes.
Yeah.
Or those who haven't had success with lifestyle changes alone.
Right.
It essentially acts as a preemptive strike.
Okay.
Helping to improve insulin sensitivity and reduce the likelihood of developing a full-blown type 2.
Interesting. Are there any downsides to taking metformin long-term?
There can be. So monitoring is important. One thing to watch out for is vitamin B12 deficiency, which can occur with prolonged metformin use.
Interesting.
So the ADA guidelines recommend periodic monitoring for anyone taking metformin.
Right.
Especially if they develop symptoms like anemia or peripheral neuropathy.
Gotcha.
It's just another example of why that personalized approach to care is so crucial.
It makes sense. Now, we've been focusing on type 2 prevention.
Right.
What about type 1? Are there any preventative measures for that?
Type 1 prevention is a much more challenging area. Mainly because we don't fully understand the causes yet.
Right.
But there is some promising research happening. One exciting development is the approval of a drug called teplizumab. Which has been shown to delay the onset of stage 3 type 1 diabetes.
Wow.
In people aged 8 and older who are in stage 2.
So it's not a cure.
Not a cure.
But it's buying valuable time.
It is.
What exactly are those stages?
So type 1 diabetes develops in stages. Stage 1 is marked by the presence of 2 or more autoantibodies. Which are basically signals that the immune system is attacking those insulin-producing cells.
Gotcha.
In the pancreas, so stage 2 is when blood sugar levels start to become abnormal. But not high enough to be diagnosed with type 1 diabetes yet. And then stage 3 is the clinical diagnosis of type 1 diabetes.
So teplizumab is intervening right before that clinical diagnosis.
Correct.
That's incredible.
It is.
And while teplizumab is specifically for stage 2, there's a lot of ongoing research exploring ways to prevent or delay the onset of even stage 3, giving hope to those at risk of developing this challenging form of diabetes.
It's a tough one.
Wow. A lot to think about.
Yeah.
So we've covered a lot of ground in terms of prevention.
We have.
What are some of the key takeaways
you
want our listener to remember from this first part of our deep dive?
Well, I think first and foremost, early detection is key. Whether it's regular checkups for those at risk of type 2. Or genetic testing for type 1. Catching those early warning signs can make a world of difference. Second, personalized care is paramount. What works for one person might not work for another. So working closely with your healthcare provider is essential.
That makes sense.
And finally, don't underestimate the power of lifestyle changes. Things like exercise, diet, and sleep. Play a much bigger role in diabetes prevention than we ever realized.
I couldn't agree more. Those are some really powerful takeaways. But our deep dive isn't over yet.
No, it's not.
Coming up next, we'll be exploring the latest recommendations
for
managing diabetes once it's been diagnosed. Stay tuned.
Welcome back.
All right, so now we're shifting gears a bit to focus on managing diabetes once it's been diagnosed.
And just like with prevention, that theme of personalized care is central to the ADA's recommendations for management.
So where do we even begin with that? It seems like there's so much to consider.
Well, a good starting point, I think, is understanding your glycemic targets.
Glycemic targets, what does that even mean?
It refers to your blood sugar goals. Specifically what your A1C levels should be.
So I'm guessing the target's not the same for everybody.
You're catching on. The ADA emphasizes that A1C targets should be individualized. Taking into account a range of factors. Like age, life expectancy, and any other health conditions you might have.
So For someone who's younger and generally healthy,
Uh-huh.
a more aggressive target might be appropriate.
Yeah.
But for someone older or with multiple health issues,
Right.
a slightly higher target might be safer and more realistic.
Exactly. It's about finding that sweet spot.
Yeah.
Aiming for good blood sugar control.
Yeah.
Without increasing the risk of complications.
Makes sense.
From overly aggressive treatment.
So once you have those targets in mind, what are the tools for actually achieving them?
Yeah.
I know medication is a big part of it, right?
Absolutely. And there's been a lot of progress in diabetes medications in recent years.
Yeah.
The ADA provides a comprehensive overview of all the different drug classes available, including some newer options like GLP-1 receptor agonists and SGLT2 inhibitors.
Yeah, I've heard about those.
Yeah.
They're the ones that not only help lower blood sugar, but also have added benefits for heart health and weight loss.
That's right. So GLP-1 receptor agonists work by mimicking a naturally occurring hormone called GLP-1, which helps regulate blood sugar and appetite.
Interesting.
So they slow down gastric emptying,
Okay.
increase feelings of fullness, and promote insulin release when blood sugar levels are high.
So they're kind of a multitasking medication.
Exactly. And then there are SGLT2 inhibitors, which work in a completely different way.
Okay.
They block the reabsorption of glucose in the kidneys, leading to increased glucose excretion in the urine.
So instead of just managing blood sugar, they're actually helping to flush some of it out.
Precisely.
Interesting.
And the ADA guidelines provide clear recommendations on when and how to use these different medication classes based on individual patient needs and characteristics.
It sounds like healthcare providers have a much larger toolbox now.
They do.
To create those, truly tailored treatment plans we keep talking about.
It really is exciting.
That's good. And it's important to remember that medication is just one piece of the puzzle.
Absolutely.
Lifestyle interventions, like regular physical activity, healthy eating, and stress management are still crucial for managing diabetes effectively.
Yeah, it all works together.
It's that holistic approach again, right?
Absolutely.
Okay, so we've talked about glycemic targets. And medications. What about the other side of the coin, hypoglycemia?
Yeah.
That seems like a constant concern for people with diabetes.
You're right. It's a very real and potentially dangerous complication.
Yeah.
And the ADA has updated its guidelines on hypoglycemia prevention and management, focusing on identifying individual risk factors and tailoring strategies accordingly.
So someone who has frequent episodes of severe hypoglycemia might need a different approach than someone who only experiences mild lows occasionally.
Exactly. And a big part of it is patient education.
Okay.
The ADA really stresses the importance of making sure people with diabetes understand the signs and symptoms of hypoglycemia.
Yeah.
What to do if it happens.
Right.
And how to prevent it in the first place.
So it's about empowering people to be proactive.
Absolutely.
In their own care.
Knowledge is power.
That's right. So beyond managing blood sugar.
Right.
What else do the ADA standards cover?
Well, for starters, there's a whole section on cardiovascular disease.
Okay.
Risk management, which is incredibly important because people with diabetes are at increased risk for heart attacks, strokes, and other cardiovascular problems.
It makes sense. So it's not just about keeping your blood sugar in check.
Right.
But also addressing all those other potential health risks that can come with diabetes.
The ADA provides specific recommendations for managing blood pressure, cholesterol levels, and other risk factors.
It's that integrated approach, again, looking at the whole person.
Absolutely.
Rather than just focusing on one aspect of their health.
Right, and they don't stop there.
Really?
The ADA also covers topics like kidney disease screening and management.
Okay.
Eye care, foot care.
Wow.
Even mental health.
They really are covering all the bases.
They are.
It seems like they're recognizing that diabetes can impact
It really can.
almost every aspect of a person's well-being.
Absolutely. And here's another really important point that I think is worth highlighting.
Yeah.
The ADA standards place a lot of emphasis on considering social determinants of health.
Social determinants of health. I'm not familiar with that term.
It refers to the social and economic factors that can influence a person's health outcomes.
Okay.
So things like income level, education, access to health care, and even living environment can have a huge impact on a person's ability to manage their diabetes effectively.
So, for example, someone who can't afford healthy food or doesn't have transportation to doctor's appointments,
Right.
is going to face bigger challenges
Absolutely.
in managing their diabetes
Yeah.
than someone who has those resources.
Exactly. And the ADA is urging healthcare providers to be aware of these social determinants of health and to connect their patients with resources and support services that can help address those barriers.
That's really important. It's acknowledging that healthcare is about more.
It is.
Than just pills and procedures.
It's about the whole person.
Right.
And the context of their lives.
Absolutely. And that leads us to another crucial piece of the ADA's recommendations. Ongoing diabetes self-management.
Yes.
Education and support.
This is where the rubber meets the road.
Right. Giving people the knowledge and skills.
Absolutely.
They need to actually manage their diabetes on a daily basis.
Exactly. The ADA recommends individualized education and support programs that cover a wide range of topics.
Okay, so we're talking
everything from how to monitor your blood sugar and administer insulin to making healthy food choices, staying physically active, and coping with the emotional challenges of living with a chronic illness.
So it's about providing people with the tools and support they need for that lifelong journey of managing their diabetes.
Precisely. And it's not just about the individual with diabetes.
Right.
The ADA also emphasizes the importance of involving family members and caregivers in the education and support process.
That makes sense. Diabetes doesn't just impact the person diagnosed.
It doesn't.
It affects their whole family and support system.
Absolutely. And having that strong support network can make a world of difference in a person's ability to successfully manage their diabetes.
Okay, so we've covered a lot of ground in this section.
Yeah.
From glycemic targets and medications to hypoglycemia prevention and even addressing social determinants of health.
It's a lot.
It is a lot to take in.
It is. But I think one of the most important messages to remember is that managing diabetes doesn't have to be overwhelming.
Okay.
Yes, it requires effort and attention.
Yeah.
But with the right knowledge, tools, and support, it's absolutely possible to live a full and healthy life with diabetes.
I agree. And these ADA standards provide a roadmap for getting there.
They do.
It's fascinating how much progress has been made.
It is.
In diabetes care, not just in terms of new medications and technologies, but also in our understanding of the disease itself.
Absolutely.
And the importance of personalized care.
It's a huge shift, I think.
Yeah.
These guidelines really represent a shift towards patient-centered care.
Okay.
They recognize that everyone's journey with diabetes is unique.
Right.
And there's no one-size-fits-all approach.
So instead of trying to fit everyone into the same box, we're recognizing the individual and tailoring care to their specific needs and circumstances.
Precisely. And that's what's so exciting about these new standards.
Absolutely. Well said. Now we have one more important area to cover in our deep dive, the unique challenges and considerations for specific populations living with diabetes.
Absolutely.
So stay tuned for our final segment.
Looking forward to it.
Or we'll explore those issues in detail. All right, so we're back for the final part of our deep dive into the ADA's 2025 Standards of Care.
And we're shifting our focus now to look at specific populations. Because while those general recommendations are helpful, diabetes doesn't affect everyone in the same way.
Right, so we'll be exploring the unique challenges and considerations for older adults, children and adolescents, and pregnant women with diabetes.
Those are some really important ones.
Yeah, because these groups often require specialized care.
They do.
And the ADA has really tailored its recommendations to address their unique needs.
Absolutely.
Okay, let's start with older adults.
Okay.
What are some of the key issues they face when it comes to managing diabetes?
Well, one of the biggest challenges is the increased risk of hypoglycemia.
Okay, we talked about hypoglycemia earlier.
Yeah.
But why are older adults particularly vulnerable?
There are a few reasons.
Okay.
As we age, our bodies become less efficient at regulating blood sugar.
Okay.
And on top of that, older adults may be more sensitive to the effects of certain medications.
Okay.
Especially if they're taking multiple medications for different conditions.
So the same dose of a diabetes medication that might be fine for a younger person could lead to a dangerous drop in blood sugar for an older adult.
And to complicate matters further, older adults may have other health conditions like cognitive impairment or mobility issues that can make it harder for them to manage their diabetes effectively.
So it's like a complex interplay of factors
It is.
that need to be considered.
Absolutely.
What does the ADA recommend for managing diabetes in older adults?
Well, the ADA really emphasizes the importance of individualizing care plans for older adults, taking all those factors into account.
Yeah.
This might mean adjusting medication dosages, amplifying treatment regimens, and providing additional support to help them manage their diabetes safely.
Okay, that makes sense. So regular check-ins with their healthcare provider
Absolutely.
are probably crucial, right?
Yeah, it's essential to monitor their condition closely and make adjustments to their treatment plan as needed.
Okay, let's move on to children and adolescents with diabetes.
Okay.
This is a group that faces a whole different set of challenges.
You're right. Managing diabetes during childhood and adolescence can be incredibly tough both for the young person and for their families.
Right.
They're dealing with all the normal ups and downs of growing up, plus the added burden of managing a chronic illness.
I can only imagine how challenging that must be. What are some of the key things the ADA highlights in terms of supporting children and adolescents with diabetes?
Well, first and foremost, they emphasize the importance of early and comprehensive diabetes education. And that education isn't just for the child. It's for their parents, caregivers, and even their school staff.
So creating a whole support system that's educated and equipped to help the child manage their diabetes.
Everyone involved in the child's life needs to be on the same page and working together.
Yeah. The ADA also addresses the psychosocial aspects of diabetes in young people. What does that mean exactly?
It means recognizing that living with diabetes can take a toll on a child's emotional well-being, self-esteem, and social interactions.
Right. It's not just about the physical aspects of the disease.
Exactly. The ADA encourages healthcare providers to be mindful of these challenges and to connect young people with diabetes to mental health professionals if needed. Early intervention and support can make a world of difference.
That makes a lot of sense. Now let's talk about our final population. Pregnant women with diabetes.
Right.
This is obviously a situation that requires extra care and attention.
Absolutely. Pregnancy can significantly impact blood sugar control. And uncontrolled diabetes during pregnancy can pose serious risks to both the mother and the baby.
So what are the ADA's key recommendations for managing diabetes during pregnancy?
Well, the ADA strongly recommends preconception counseling for women with diabetes who are considering getting pregnant. This is all about optimizing blood sugar control before conception.
So getting a head start.
Exactly.
On managing the diabetes before pregnancy even begins.
That's the goal.
And once a woman with diabetes becomes pregnant, close monitoring of blood sugar levels and adjustments to her treatment plan are crucial.
Absolutely.
This might involve changes to her medication regimen, more frequent blood sugar checks, and dietary adjustments.
Yeah, it sounds like a lot of ongoing communication.
It does.
And collaboration with her healthcare team. It is. And the ADA also provides specific guidance on managing gestational diabetes.
Gestational diabetes, that's the type of diabetes that develops during pregnancy, but it goes away after the baby is born, right?
Usually, but not always. The ADA recommends screening for gestational diabetes between 24 and 28 weeks of pregnancy. And if it's diagnosed, managing blood sugar levels through lifestyle changes, and if necessary, medication is key to a healthy pregnancy.
So even though it's often temporary,
it
still needs to be managed carefully.
Absolutely. And here's the thing. Having gestational diabetes increases a woman's risk of developing type 2 diabetes later in life.
Oh, wow.
So postpartum follow-up care is really important.
So it's not just about managing the diabetes during the pregnancy, but also taking steps to prevent future problems.
Exactly. It's about long-term health and well-being for both the mother and the baby.
That makes it... Wow, we've covered a lot of ground.
We have.
In this deep dive into the ADA's 2025 standards of care.
A lot of information.
It's been incredibly informative, and I hope our listener feels empowered with this knowledge.
Absolutely. And remember, these standards are just a starting point. It's essential to work closely with your healthcare provider to create a personalized plan that meets your individual needs.
I couldn't agree more. We've only scratched the surface of this complex topic. So we encourage you to check out the full ADA Standards of Care document.
Absolutely.
And talk to your healthcare provider about what it means for you.
Great advice.
And as always, thanks for joining us for another deep dive.
Yeah, this was a good one.
We'll see you next time.